And we are back with part 2 of Ask the Doctor. Have you ever wanted to just sit with a doctor and ask questions and get their insight and advice on your caregiving journey? Well, tonight is your night. But first, I want to welcome you to the Caregivers Compass, where we guide you through the journey of aging, caregiving, and life's most important transitions. I am BreJeanna Webb. I'm an occupational therapy assistant, a senior care and transition strategist, a licensed realtor, and the founder of Compass Senior Living Advisors. Together with my partner, Crystal Goddard, who is not with us. She is on marital leave. She's not with us tonight, but we come together to help families navigate senior care, housing options, and the emotional decisions that come with it so that you don't have to do it alone. Tonight, I am interviewing Dr. Cynthia Tanguilig-Robinson. And let me tell you a little bit about her before we get started. She is a graduate of West Virginia School of Medicine in 2001. She also holds a medical director certification. She's been caring for patients since 2001, and she focuses specifically on seniors since 2015. Her preferred focus is on dementia care, caregiver education, healthy aging, and hospice and goal care. And her mission is to strive and let patients have as comfortable and enjoyable life as possible, while also helping to support the family's needs. So again, let's welcome Dr. Robinson to the show. So Dr. Robinson, before we get started, I do want to start our first segment of Mythbusters. I'm going to ask you some myths, and you tell me if they're facts and myths, and if you want to elaborate a little bit on them, you can go from there. So we'll do 5 myths. So let's talk about dementia. You're certified, you're a dementia practice, specialized in dementia care. So once someone is diagnosed with dementia, there's nothing that a family can do to help them after that?
Well, again, I don't think that's a good, true, false type thing. But there's no medication that's been shown to reverse it completely and eliminate dementia. We know it's an illness. But what you're trying to do is prevent the sort of slope of the decline from being too steep.
Yes.
So families can do things to make that dementia not progress as quickly. Okay. So things they can do are trying to encourage more socialization. That's been shown to be just as good as some of these medications. Same with exercise.
Oh, wow.
So the mental and physical exercise can help people, again, decrease that decline, the slope of the decline.
Okay.
The other thing I always tell people is, from the age of 55 on, people's memory will decline. That's just physiology. What can you do to work your brain? The brain, I like to tell people, think of it like a muscle. So do things that make it actively work. That means if you always do the crossword puzzle, start doing some of those number things like Sudoku. Always played cards, maybe try something more tactile like Scrabble. Learn something new. Do a Duolingo and learn a new language. If you're not good with a phone, sit down at an Apple store and learn how to use it. It's hard. It's not easy, and it could take a long time, but that's making your brain really work. And if they really want their family or ones they're caring for to get better, making them do the hard things is what's going to help their memory and their cognition.
Very good information. Okay, so my next question is, older adults should avoid exercise because it's too risky. You're thinking of osteoporosis, bones get brittle. They shouldn't exercise. Is that a myth, or is that?
That is a myth, because sometimes it's the exercise and that weight bearing, which is going to give their bones extra strength. It's going to make muscles work a little bit more so that they protect the joints and they're less fall, which could lead to a fracture, which could really affect their functional status overall.
Okay. And so the next one is myth or fact. Is it normal for seniors to lose their appetite as they age?
I think people will eat less as they get older. Doesn't necessarily mean they have to lose their appetite. Their body just requires less calories. So I don't know if that's kind of yes and no.
Yeah.
They are eating less, but it's not because they suddenly have no appetite for food. It's just their body needs less calories.
Okay. This one's this definitely is a good medical question. So a urinary tract infection only causes urinary symptoms.
False. Because some people won't even know they have they won't have any urinary symptoms. Sometimes it could be a bump in their temperature, but a lot of seniors don't really mount a high temperature anymore. So for someone that has a urinary tract infection, it could be their temperature is 98, but it typically runs 96. So for them, that's a temperature, which could be related to a urinary tract infection. Sometimes it could be abnormal behaviors. That could be a urinary tract infection.
Yeah, that's the one I wanted to get to. I think a lot of people don't realize that a UTI can cause confusion. That, a lot of people don't put those two together.
I think the flip side of that, though, is so many people automatically will assume that the confusion is then a urinary tract infection. They'll empirically start antibiotics. That's where you start seeing these development of these superbugs, which suddenly now antibiotics for. So there's a real swing in treatment of infections. Back in the 80s, someone had a little cough and cold, they got a Z-Pak. Someone had a little something, you got a couple of days of an antibiotic. Now we're seeing in seniors, if you are doing that all the time, they're starting to develop these superbugs that then it's going to get to a point where you can't treat them. Sometimes confusion is in an infection as much as dehydration, or sometimes it could be something like they could be retaining urine or constipated. So now it's absolutely, confusion can be a urinary tract infection, but a lot of people will come in and automatically assume if they're confused, you have to treat my person. And that's always the case.
Yes. Okay. So how about taking more vitamins is always better for older adults?
I don't like that idea because sometimes the pills themselves can fill someone's stomach. So then instead of eating real food, they're thinking, well, if I have 20 vitamins, that is a good substitute for just having 3 square meals. That's incorrect. Sometimes they can overdo it and take too much of a vitamin, which can also be bad. So I think vitamins have their place, but because they're not regulated, some vitamin carriers maybe aren't as pure as others, and then you get these other additives, which could be bad. So if there's a deficiency, you're low in vitamin D, you're low in B12, you're low in iron, you need the vitamins, but do you need the hundreds of ones that are out there? Not necessarily. I would rather people eat food than just have vitamins.
Yes. Okay, so I don't remember if I did 5 or 4. I'm just going through them, but that was very good. Thank you so much. We'll move on. So our first segment is we're going to talk about preventing hospitalization for both the loved one and the caregiver. So what are some of the most common reasons older adults end up in the emergency room, and how can caregivers help to prevent those situations?
Oh, I don't know if I know the number one reason, but falls is a big one.
Yeah.
More often than not, it's a fall, a slip, and there's pain, and then they have to go to the emergency room. With that, it's prevention. Sometimes houses can be quite cluttered, especially seniors, and route between the bedroom and the bathroom or the bedroom and the kitchen can be so cluttered they're having to walk around things. Or there's carpets still that don't have non-slip rugs or that are easy to trip on. So I think a good way is if you yourself don't know what would be a safe sort of environment, having a therapist, an occupational or physical therapist come in to do a home safety eval once is useful, just to get a feel for what can we do to make things as safe as possible. And also, a lot of falls happen in the bathroom. So for the same reason, having them look and see, is there grab bars we could put or something that will make it safer.
My partner, Crystal, she's actually a certified age and place specialist. And so being able to come in the wrong home and to look around and see, things that can be done to keep the individual safely at home.
Exactly.
Yeah. Okay, so what daily habits or routines can significantly reduce a risk of falls, infections, medication errors, or other preventable hospitalizations?
I mean, things with falls, we already talked about the sort of home safety eval. The other thing I've noticed is a lot of this sort of current old generation, if you will, have higher beds. So that's an easy thing where you can get low profile box springs so that the clearance from the top of the bed to the floor is a lot shorter. And likewise, if there's a fall out of bed, it's not as high a fall, so there's less risk for any fractures that way. So that's a simple thing. Medications, that's a big one. Are they taking them correctly? So using the pill divider things that you can get from the pharmacy. And then having one person be in charge of filling it for the week and checking it maybe in the middle of the week and at the end to make sure everything's taken. That's another easy thing. And then just making sure they go for at least an annual checkup. Again, there's lots of little things that can creep up on you. Like you can get dehydrated. Well, if you're getting some blood work in a kind of reasonable every 6 to 12 months, you would maybe see that and then be able to encourage them to drink more to prevent dehydration being a reason they end up in the hospital.
Okay. So tell me, what red flag symptoms should prompt an immediate call to the physician, and which symptoms require maybe a 911 call?
911 would be any concern for a stroke or heart attack. That's not worth waiting around because the seconds are precious. Any fall that they have such pain they can't move, again, that's probably 911 to the hospital to get an immediate x-ray. Now, for some people, it's questionable. They can still kind of move, but in pain. If it's nighttime, is it better to go to an urgent care, or if the pain's tolerable, then you just go first thing in the morning? And that one I say because for some seniors who they're both in their 80s or 90s, they have a fall. For one of them to drive the other one to the hospital could be just as dangerous if it's morning. So that's where I say, everything with a overall picture, kind of good sense, common sense.
Good common sense. Okay. And this is a really good one. So many caregivers don't realize they're headed towards burnout until it's severe. So what are some medical and emotional warning signs that a caregiver's own health is declining?
I think for the caregivers, if they start noticing just really high blood pressures, heart rate, palpitations, stress, those are all signs of stress, which can lead to high blood pressure. Some of that racing heart rate could be stress alone. They are not eating as much because they're just too stressed or having to spend too much time taking care of someone that they're not taking care of themselves. They start noticing any decline in their weight, or they're not sleeping as well. Those are all things, or their temperature's shorter, or start seeing they're not seeing their friends and family anymore because 100% of their focus is now on their loved one or patient.
Yeah.
That's going to lead to burnout. If you
Yeah.
can't have your own life and take care of yourself, how can you take care of someone else?
And what are some things that just some suggestions of things that they could do to kind of their caregiving? They may be the only sibling or that's actively involved, whatever their case is, or they don't have anyone but themselves. What are some practical things that they can do to kind of steal away and reconnect with some level of peace or some level of kind of coming down, calm? What are some things that they possibly can do?
I think for some people, especially if they've not had to caregive for someone before, is knowing that they're not alone. You know,
Mhm.
a lot of books that will talk about dementia caregiving and what the day entails. Seeing that someone else has experienced what they're going through helps a lot. I know with the Alzheimer's organization, they have a caregiver support group that meets. I think I know it's once a month, but it might be even more frequently.
Mhm.
Talking with other people about what they're going through can be very helpful. I often talk to families where there's 4 siblings or more, and only one lives in the city of the patient. And I say, you need a break. So if you even say to your 3 siblings, you can spare 1 weekend every 6 months. And if you say it like that, someone's got to be really selfish to be like, oh no, I can't do 1 weekend in 6 months. But
That's
that
good.
is huge for the main caregiver. And
That's
if you then
good.
have more siblings or more people, you need to accept help. You can't try to do it yourself. I've often suggested for people that don't have family, make a list of all your friends or people that are willing to help you. A lot of times you'll hear people say, "Oh, I'll do, whatever you need." Well, call that in. Say, okay, once a year, and you don't make it a recurring thing that could seem a burden to someone.
Mhm.
You say, look, once every quarter, once every 6 months, if you could
Mhm.
come for a day or now,
Mhm.
you have to have something to look forward to that's
Yes.
going to be your time to turn off.
Yeah. That's really, really good. I like the idea of the siblings. If you have other siblings that live away, if we could schedule this
Yeah.
sibling
Yeah.
takes this weekend for every other month. This weekend,
I
and then
say
the other month,
start out super easy where they can't say
6 months.
no. No, seriously, right?
Yeah.
No one's gonna say, "Oh, I can't do that." Like, how in the
Yeah.
world can you tell me you don't have 1 weekend free in the next 6 months? No
Yes.
one can say that. And then they'll maybe realize, "Hey, what you're doing is so hard." They'll then come around to doing it more. You see what
Offer
I'm
more.
saying?
Yes.
To change other people's mindsets.
That is so good. That is so good. Thank you for that one. And we're going to continue this last segment. We're going to talk about protecting the caregiver's health. And so that was one really great suggestion to go into that journey of protecting the caregiver's health. And so we're going to talk about research shows caregivers can take a serious caregiving can take a serious toll on physical and mental health. What health risk concerns you most for family caregivers?
Probably the physical toll. I think
Mhm.
it'd be really hard, all the transfers, bathing, if it gets to that point, if they're
Mhm.
not properly trained, and then they can throw out their back or hurt themselves even more. That's probably a big physical thing. The other one is really the emotional. Like I said, a lot of people get depressed and stressed because it's hard, and they don't often feel that they have any help in the matter.
Mhm.
So
Yeah, and the physical toll of not really caring for yourself, not going to your appointments.
Right.
Not seeing what your levels are.
Right.
As well. So that's really important. Getting those blood tests
Exactly.
and really seeing what's going on with you, because stress is, it can really affect you.
Right.
So caregivers often put themselves last. What annual screenings, checkups, or preventative care should they make a priority?
I mean, just the annual exam, it's going to vary depending on their age. So
Mhm,
at least go for their annual exam every year. I mean, I don't think
mhm.
they can say all caregivers need XYZ because different ones have different health backgrounds.
Okay. So how can caregivers then manage stress before it leads to things like anxiety, depression, chronic illness, or burnout?
I guess with that, the sooner you can find support, the better. The sooner you can talk to other people that are going through the same thing, the better. You have someone to sort of commiserate with.
Mhm, mhm,
And there's link between pediatrics and geriatrics is so great. I remember
mhm,
kids, it was a lot, but once
mhm,
you start going to the mom and tots and the different play groups,
mhm,
that time talking with the other people, the moms and dads that are going through the same thing, that's
mhm,
what gets you through it. Caregiving
mhm.
seniors is no different. You need to be able to talk with other people doing the same thing.
It's funny that you make that comparison. So I worked in pediatrics for years, and also my love is geriatrics. But working with each population, I see such a similarity when working with kids. It's working with aging adults. They have a lot in common.
They do, but I will also say a lot of the seniors don't want to be considered babies or
Correct.
treated like, well, I'm not your child.
Mhm.
So even though the similarities are there, never say that to a senior.
Absolutely not. Oh, absolutely not. Absolutely not.
Yeah,
I have the highest respect for my seniors, but it's quite amazing
it is.
to
It is.
see. It's almost like that circle of life. It's almost like this circle you're kind of going back around.
I went to an aging conference once, and I remember it was I think a nursing home in New York where they
Mhm.
did a painting class for the seniors and kindergartners.
Mhm.
All had so much fun because it was finger painting. It was stuff that even people that had severe arthritis and stuff could do,
Mhm.
would help each other.
Mhm.
Just really cute to see the joy that
Yeah,
we both got.
I can imagine.
Yeah.
Okay, so when should caregivers recognize it's time to ask for help, and what types of support are available to many people that many people overlook?
The free online support, like I said, the alzheimers.org, they have
Mhm,
their, I think education is key. So if people can learn about what they're trying to do and what to expect, like
mhm,
what the progression of dementia is going to look like, just that knowledge is going to be useful. And
mhm.
then finding support groups between all the social media, YouTube, Insta, Facebook, there are communities that are free. Access them.
There are some amazing communities on Facebook. And speaking of, let me have a shameless plug. I have a community on Facebook as well, the Caregivers Compass. Feel free to join us there and share, connect, and grow together. And so, if you could give every caregiver one prescription, not medication, but one habit or practice to protect their health, what will it be?
I would say always try to find the humor in something.
Mm,
I think when things get too serious and all it is just slog, 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 work, 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 you're going to make yourself miserable. So there are some funny things that can happen. And if you can laugh about it, the patient laughs and it just makes it a lot easier. Maybe a laugh or a smile, either way. There's always something good to be found in it. And if you don't seek it out, you're not going to find it.
And I would add to that too, take a moment to breathe, and then take a moment to just be grateful. Find gratitude throughout your day.
Yeah, that's a good one.
Mhm. And so we will close with my question I posed last week, which is, if you could leave every caregiver watching today with one message of hope or encouragement, what would it be? What would you want them to remember?
I guess I would want them to remember that any time that they're giving is a relationship, and the human relationship and that bond, that's what makes living worth it, right? So to take that relationship and enjoy it and be grateful for it.
Thank you so much, Dr. Robinson, for this interview. Thank you for taking the time out of your busy schedule to help us empower caregivers out there. And if you found any value in the information that you received on today, I would ask you that you like, you comment, and you subscribe to our channel. If you have any topics that you would like for us to cover, put it in the comments and we will see what we can do to address it. And until next time, thank you for supporting us here at the Caregivers Compass, and we will see you next time. And remember, we do have a Facebook group, the Caregivers Compass, on Facebook. Join us. Be a part of the community. Help us to grow together, support each other, and empower each other. So until next time, I'll see you here at the Caregivers Compass.